Hello, friends. I'm going to be discussing issues of health, topic fibroid and cervical cancer. Yes, today I shall be discussing female tumors. I will take my time, maybe tomorrow and then I shall discuss male tumors. You see, female tumors are one of certain lesions that disturb young girls, especially sexually active women. Well, there are some tumors that cut across all stages of life of women, yes, all ages. However, issues of fibroid, known as Leiomyoma, is common among sexually active women. What I mean by sexually active women, I'm talking about from the age of puberty to menopause. Yes, when a woman starts seeing her menses to the last stage of her menses. Yes, fibroid or fibromas is common among such age range. Yes, the reason why fibroid is common among our young ladies in this part of the world, even in the West, is mainly due to their social habits. Yes, due to their social habits. A lot of women, because of social custom, because of maybe women, the way society, the way certain values, or most value, frowned at women who gets pregnant out of wedlock. So women on their own, to keep their status, go on to take certain measures, take certain drugs, other measures to remove the unwanted baby, to remove the baby. Yes. You see, that is why sometimes I would like to advise parents that they shouldn't just be so aggressive on their young daughters that necessarily take in. The best thing is to give them a good background training at home, tell them the danger of being pregnant outside wedlock, so that this lady will not be pushed with societal pressure, certain value system that they try to maintain the status quo. And by so doing, once they take in, some of them acquire certain drugs, certain abortive drugs for termination. Yes, and most of these drugs contain female hormone, drugs like estrogen. During my youthful stage in my teens, in the 80s, early 80s, you see, to late 80s, even to early 90s, this drug was still very pronounced in a lot of pharmacies, in most pharmacies. But I know today that you rarely see such drug, estrogen. Estrogen contains estrogen, female hormone. And estrogen, unnecessary production of estrogen induces formation of fibromas, known as fibroids. Medically, it is called leiomyoma. Yes, you see, leiomyoma take its root from the smooth muscle of myometrium of the uterus, because the myometrium, the uterus, otherwise known as womb, has three muscle layers, because it's a disease of smooth muscle. Has three muscle layer: the myometrium, the endometrium, and the perimetrium. Yes. So the fibroid take its root from myometrium. You see, histologically, what I mean histologically, macroscopically, it's reminiscent to a lace-like structure. Yes, that is how it appears under the microscope. But grossly, it is a whitish and round substance, just like a football. Yes. But when you view it under the microscope, it's just like you can be compare it with a lace cloth. Somebody who put on lace. The structure of fibroid is reminiscent to that, with deep stain nucleus and all that. So it is very easy to identify. What I'm trying to say is that there are times this fibroid, once it overgrown, it could be a competitor. It could compete with a growing embryo, especially if the woman is pregnant. Yes, but most times women can take in without being disturbed, even when they have fibroid. But in some rare cases, if the fibromass is large and having tendency of growing towards endometrial canal. Endometrial canal is a hollow layer in the womb where baby implant, where baby grows. Because fertilization takes place in the fallopian tube, in the oviduct, with the help of PEG cells, certain ciliated cells that waves, it moves the fertilized egg towards the endometrium to be implanted. Once it is implanted there, in the endometrial canal, in the hollow part of the womb. You see, a beautiful, how will I call it? You see, embryogenic development is so interesting. So, what I'm trying to say is that you see, there is what we call sensitive trophoblast and cytotrophoblast that develop to form a figure-like structure that will, penetrate deeply in the womb to hold the developing follicle, to hold the baby growing tightly, just like a plant, a seed being planted. Then once the plant is growing, the root is growing to the ground to hold the plant firmly. Yes, that is how it is in humans too. Then a blastocytic cavity is formed too to kind of protect the baby. So what I'm trying to say is that if there's a fibroid that is growing towards the endometrial canal. The endometrial canal in which baby implants could be uprooted, and that will lead to miscarriage. Yes. And once it leads to miscarriage, that person could have spontaneous, could lose the baby. Yes. Spontaneous abortion is called miscarriage. Yes, because that Leiomyoma uterine now serve as a competitor. Yes, that is why you see sometimes some few persons that have fibroid, once they take in, they lose this, they take in, they lose it. The reason is not far from this, that the fibromate is growing towards the endometrial canal, thereby, uprooting the growing fetus, the growing baby in the womb, and as such, it could lead to serious bleeding. Normally, people with fibroid, most times, once they see their menses is always very deep. They bleed profusely, and the bleeding could last for several days. It could last for 10 days, 8 days, even more. Yes, with a lot of excruciating pains and all that. So we should develop certain social habits to avoid this type of lesions. Yes, a lot of abortive pills, preventive pills contain this estrogen, and as such, avoidance of such is very important because most secretion of estrogen in the system could lead to development of fibromas. Yes, as you know, fibroid rarely turn to cancer because fibroid itself is a benign lesion. The leiomyoma is a benign lesion, not an invasive or cancer lesion. Yes, cancer and fibroid and other cancer are tumors. But however, the what we call benign tumor. Benign tumor is a slow growth of tumor and onset. Whereas the malignant tumor, which is the cancer, is an invasive, is a fast growth of, uh, of such lesion. Yes. And in some very rare cases, leiomyoma, fibroid, could turn to leiomyosarcoma. That is the cancer aspect of fibroid, which will now be regarded as leiomyosarcoma. And when such happen, some of the cells could go to distal part of the body. Some of the cells could attain the liver cells, could attain the brain cell, bone marrow, and distal part of the body to start destroying cells in those areas. Yes, that is why it's invasive. Yes. So we should cultivate such a behavioral patterns to prevent all this. And not just taking to what I would call social custom, social value, what this hard society will rate you now, will give you a low morale, and because of that you start taking all this drug to terminate the ongoing pregnancy and all that. And if you did succeed, it gives you a lot of problem. Yes. And another aspect of female and neoplasm is cervical cancer. Yes. Neoplastic lesions are difficult to treat. Yes, when I mean neoplastic, I'm talking about tumor or cancer lesions. Yes. You see, cervical cancer is frequent in women these days. Very frequent. Yes. Maybe again, social habits is implicated. Then sexual promiscuity is implicated. Infections and certain drug intakes, yes, are implicated in the genesis of cancer of the cervix. Yes. Now, the female genital has vagina, which leads to the outside. Sperm is normally deposited in the vagina. Then the door to the womb is called the cervix. After the vagina, the next muscle layer is the cervix. So it's normally a tight junction. It's an entrance to the womb. Yes, that area is called the cervix. Yes, before cervix, after cervix, you get to the womb, the uterus. Yes. Now, cervix is normally the seat of inflammatory based lesions and neoplastic lesions. What do I mean by inflammatory based lesion? I'm talking about cervix is seat of infection, sexually transmitted diseases. Yes, and tumor diseases that leads to cancer. Yes, because this region is very tight. You see, a woman that is pregnant when in labor secrete oxytocin. Oxytocin help in dilation of the cervix so that the cervix will open. What I mean dilation, this oxytocin, this chemical that is secreted within the body, induces opening of the cervix so that baby will easily come out and such one will have safe delivery. But if oxytocin is not well stimulated and all that, and this thing could be due to oxytocin release too, sometimes is due to a kind of pathological indices. When you remove fear and all that, there's more secretion of oxytocin. BP and other cardiac-related diseases can even hamper complete release of oxytocin, so that such person will not dilate, will be in labor, and if the other baby is already coming out and the woman uh, did not dilate very well or push very well, the baby could be strangled, and such woman can give birth to a stillbirth, a dead baby. Yes, it is this layer I'm talking about. It normally is a seat of infections. Yes, inflammatory based lesions and neoplastic based lesions. Yes, it is proven in medical science that a woman with multiple sex partners have a very high tendency of developing cellular changes, of developing cancer of the cervix. Yes, because the brushings of the cell lines of the vagina and the cervix all the time with different sex partner could lead to structural changes of the cells, thereby developing metastasis to invasive cancer. Yes, that is why it is always good for women to keep low, to keep one sex partner. Women who keep multiple partner have that likelihood to develop cervical cancer. Yes. You see, another uh, indices of pathogenesis of cervical cancer is due to a virus called human papilloma virus. It's highly implicated in cervical cancer. Yes, it will be sexually transmitted. Yes, it will be sexually transmitted. Even a drug known as diacylstilbestrol is highly implicated in cervical cancer, can lead to cervical cancer. A lot of people those days, such drug is not so common now. We are being abused, and people start developing cancer of the cervix. You see, viruses can change the cell morphology, cell structure, and induce unnecessary production of particular cell types. Yes, the epithelial cells of that area could just change, could just be growing unnecessarily, abnormally the normal or supposedly cells of that particular organ or tissue. Yes, and such condition can be described as tumor or cancer genesis, depending on the growth pattern of such lesion. Yes, you see, drugs, abuse of drug, and much intakes of certain hormonal drugs. You take drugs for prevention, for abortion. There are some girls that find the habits of taking certain hormonal drugs, maybe when they want to make love. Some could insert through the vagina, some could take it orally. Yeah, what I mean orally, that is taking it with water. Yes, forgetting they just want to have immediate gain, not to be pregnant. Forgetting that the drug will have more side effects. Yes, you see, all these hormonal drugs have a way of inducing pathogenicity, have a way of inducing cancer, tumor, or problem to individual. The drug you took maybe yesterday, the effects, the negative effect will come in 2 years, in 5 years, in 10 years, in 15 years, 20 years. The person start having cancer problem and all that. Then the person will know that the drug she took several years ago is a drug that induced such cancer genesis. Meanwhile, we blaming his forefather, his home, his village, or thinking a spiritual attack, his neighborhood and all that. Yes, when he goes to church, they will say it's this, or that, not know that the person's behavioral pattern actually incur such disease condition. It is good to, run away with extreme negative behavioral patterns. And sometimes do not allow societal values and norms to dictate your positive behavior. Yes, because sometimes when you allow certain social custom to dictate your well-being, you could land yourself in trouble. Yes, and extreme wrong behavior is bad. Any behavior that is too much is bad. People who are extremists, who practice extremism, do have extreme negative effects. Yes, well, there are food that when you take daily, it could prevent such genesis of such cancer. Yes, but however, certain medical measures is tailored to treat or to manage these diseases. As you know, most cancers are not curable, but there are some few cancers like endometriosis and endomyosis. Yeah, they take it through from endometrium, take it through from the womb. Yes, these are two cancers or few cancers that are 100% curable, but most cancers are not curable. Yes, cervical cancer are not curable, you just manage it. Yes. So now, the medical measure that can be tailored to treat this cancer is radiotherapy and chemotherapy and surgical resection, that the use of surgery. Yes. You see, especially Leiomyoma uterine, I'm talking about fibroid. Fibroid surgical resection will remove the fibroid because the fibroid mass is like a whitish, a round whitish football-like structure. Yes, that's the gross appearance. But the macroscopic appearance is a lace-like material. Yes, yes, we the histopathologists, we will see it as a lace-like material under microscopic view. Yes, if you can actually, as a trained histopathologist, yes, you must be able to reslice. So that is it. These are what you are supposed to detect or diagnose and all that before you can actually claim that such person have Leiomyoma uterine, known as fibroid. Yes, you see, the use of radiotherapy is somewhat the best because you extray, you form of you radioactive isotope, a form of rays to kill the tumor cells. Yes, rather than you rendering them useless. Then surgical resection too and chemotherapy. Chemotherapy gradually slow down the growth, regresses the growth of the fibromas. That is, it makes it smaller, smaller until it disappears. That is chemotherapy. Yes, but however, it's just a temporary measure. It could still come up. That is done to actually, if a woman needs a baby before it grows up, before the fibroid grows up, then you must have had several babies. However, a lot of people have fibroid and they can develop and they can take in and deliver safely. Yes, but some few do have problem. Yes. Well, the food therapy that can be tailored, to prevent is merely for prevention this time around. If you are individual who capitalize on taking, raw onions and contain antibiotics, antiviral, it boosts immunity and anti-tumors. Yes. If you are such person, you won't have all this problem. Then aloe vera. Aloe vera is antiviral too, antibacterial, antiparasitic. In general, antimicrobes. There are a lot of microbes. There are viruses, bacteria, many parasites. There's rickettsia, there's chlamydia, there's prion, and others. You see, aloe vera has, treatment effect on all types of microorganisms. Yes, and it's also anti-tumor, boost immunity. The same with garlic. Many of them, you see, these are food intakes. Aloe vera can be eaten raw. Yeah, you can do a form of salads. You understand, you slice aloe vera on it. Start taking it. Prevention is better than cure. Because when these diseases ensue, it may not be reversible. There are certain diseases that are not reversible. It will just be there without be managing it. And some of them can induce anemia, can induce hemodilution. It's a destruction of red blood cells and invade tissues, making the person cachectic, becoming so slim, depending on the clinical cause of the disease formations. Yes. Worse, prevention is better than cure. Thank you very much for listening. I shall be discussing male lesion some other day, more male tumors, male cancers some other day, either tomorrow or next. Thank you so much.